the note taker to see it.
Awesome. Thank you. Great. Okay. So now I'm going to stop sharing our agenda briefly so that I can share with you for our budget review. So I have a couple things. I have slides that we'll start with that I sent out last night. Here we go. Sorry, sharing too many buttons. Okay, and I just need, oops, a little out of order. Oh. There we go. So budget adjustments. Sorry, why isn't it changing in my? Oh, there we go. Okay. Can people see? No, you're not seeing. Do you see a slide that says FY25 trimester budget, or?
Yes.
You do? Okay. Sorry, I have two screens running, and one is showing one slide and one is showing the other. So I just want to make sure I've got the right one. Okay. So because we have our trimester reporting due on, it's actually due December 2nd. Jen and I are planning to have it all finished before the Thanksgiving holiday. But so as part of that, we have to review the budget, and I'm just setting the table. So we have two adjustments that we're requesting right now for changes in the line items of the budget. The first one is a previously approved one. The board voted on this before, asking that we move $10,000 from the line item for to make whole the funding for the Dover Sherborne shared nurse. And then the second one is a request to populate a line item to cover some dues, some membership fees that we have. And so that you are able to follow that and not just trust my words, I have, I'm now going to share with you. Like I said, too many screens. Okay, so now you should be seeing a colorful dashboard. And at the top it says Needham dashboard. And this is the Smartsheet application that the state has us working in to manage all of the activities for the grant. This is specifically about the budget. So you can see all the line items that we have, and it actually is, you have to scroll down in the window. So what's happening is the line here, the line that says, you can't see my pointer, the line that says nurse. So the one immediately above the line, that the white line for epidemiologists, there's a line that says nurse, right? And that was budgeted for a full year of the regional public health nurse, Jennifer Gangadaran, who you all met at our last meeting. And because Jennifer didn't start until October 21st, we had a quarter of unspent funds, and we used those dollars to put $10,000 into the other public health staff line, which is immediately below epidemiologist. That other public health staff line is the Dover Sherborne, well, the Dover public health nurse position that Sherborne will be participating in. So that's the first request that we made, and we made it to you already. we have to make it to DPH. So I'm alerting you that that's what we're doing. And then we're also asking if you see there's a peach line called, and it's membership fees. And there's an amount spent of, it says in there, of $1,100, and you see the budget amount is 0. And the percent remaining says no budget allocated. So what I'm asking is that we will take we'll take $1,100 from that unspent funds in the nurse line, and we will budget for the membership fees. Those specific membership fees are costs already incurred. It is $600 for Mass Association of Health Board membership for each of the 4 communities. Mass Association of Health Boards directly billed Charles River at the beginning of the fiscal year. So we've paid for each community. And the other membership fee is a $500 membership fee to the Association of Public Health Nurses, which is a regional membership for all 4 communities. And those items were not budgeted for. So I am asking that we move the dollars to accommodate that. Okay, now tell me what you need me to clarify or restate.
I think the only
Carol.
question I have is, oh, sorry. I
No,
thought
that's
you said
okay.
Daryl, it's like, how did you know I was gonna say something?
No, that's okay. Go ahead, Daryl. That's fine.
Is this something that will happen through shared services in
What's
years
that?
to come, or
What's that?
the payment of those dues? Because we're accustomed to paying for them, so.
Right. So I think that's it's a great question. I think it feeds into our next question, our next topic about sort of what our policy will be for what items should Charles River be paying and what items would the towns pay. And Mass Association of Health Boards, made the decision to invoice that way. We could certainly make the decision to, going forward to say, nope, the individual town would like to be invoiced for that. Does that answer your question, Daryl?
Yes, thank you.
Okay. Carol?
Yes, thank you very much. So you outlined that you're adding 10,000 from the unspent funds from the regional nurse, correct?
Correct.
To the Dover public
Correct.
nurse,
Correct.
which is yet to be filled.
Correct. So, and
hang on,
yeah.
just
Yep.
my question is, what is the total allocation for FY25 out of the FY25 budget for the Dover public health nurse, which will be hired?
So this group had agreed that they would contribute the $40,000 that would be able to make that position a full-time position. And sorry, it's a little complex. So the allocation by right should have been $40,000. I used a December budget, put it in and shared it and budgeted it for 20. So the allocation was going to be $10,000 per quarter. And I think, yeah, I'll stop there.
So the original budget, and forgive me because I have stuff printed, but I don't want to take a lot of time. The original approval for FY25 for the Dover public health nurse was 20,000.
Correct.
Now it will be 10 plus, so 30 total.
It will be 30. And we will, anticipating that that position has not yet been filled. I will be coming back to request that we move funds and reallocate at that time. But for this trimester reporting period, we're reflecting what the action of the board was. That answer your question?
Yep. And
Okay.
I appreciate all the details here. And the other change, great. Thank you very much for the membership fees. And I appreciate you funding the nurses regionally through the MAPHN.
Kay, I see you have your hand up.
Yes, so we have a little news about the nurse.
That's great.
Do you have something else you need to do? Because
No, I'm sorry. No, that's great. You have news about, excellent.
so we've hired somebody who will start February 1st.
Okay.
And her salary, total salary will be 83,000 approximately.
Okay. And, so, and this body had agreed that it was to the benefit of all of the communities to use funds to make that position a full-time position. So Charles River would be funding 15 hours per week because Dover has authorized, town of Dover authorized in there by town meeting a 25-hour-a-week position. So mechanically, the way it will work is that Dover will need to invoice the town of invoice shared services and then we can provide funding for that. So, okay, so February 1st, so then that means we'll have a little bit, we will have funds to adjust, but that's great news. Congratulations.
Thank you. We're
I
really
know. Yeah, I'm sure. That's excellent. Congratulations, Jason. I ran a nice hiring process. Okay, so any questions, any further questions? So what I need from you all, what I put in is I need a vote saying that you approve the movement of funds between line items as I've described. And so I see, Carol, you've got your hand back up.
Yep.
Or is that? Yeah,
I just
okay.
wanted to ask, as far as municipal, like the timeline in the state, when do you know the allocation for FY26? And now that it's almost, when do you start with the new budget planning?
Carol, you're awesome. I have a little chart that I was going to share in a moment that shows I am anticipating that I'd be bringing a preliminary budget to this group in April. And then I would have a final budget in May and we'd have to submit it sometime at the sometime in the month of May. I don't have dates from the state yet. Does that help?
Thank you.
You're welcome. Okay. Ed, I see your hand up.
Do you have a tentative budget figure for next year, FY26?
We will be level funded. We have been told that we will receive $325,000. We have a contract in place actually
Okay.
for the 3 years, so flat funds.
Okay.
Okay. Any other questions? Okay, not seeing any other questions. Is there anyone who'd be interested in making a motion to authorize the movement of funds from the nurse line item to to the membership fees line item as described?
So moved.
Second,
And is there a second?
Second,
Oh, second. Okay, discussion? Carol, did you have a question before I ask for a vote?
no, I was going to ask if you
Oh.
wanted me to make the motion.
Oh, okay, got it. Okay, so we have, it was moved and seconded. So now roll call, Dover,
Aye.
okay, and Medfield
Yes,
and Needham
Yes.
and Sherborne.
aye.
Excellent. Okay, thank you very much. So now I will stop sharing this screen. And next item is to talk about a proposed policy for conferences, for payment of conferences, trainings, and licenses. And I have to share my PowerPoint again. Okay. Zoom, share screen. And here comes. Okay. Are people seeing the screen where it has conferences and, okay, excellent. So what I did was kind of just lay out, what I wanted to give you was the landscape of what is possible. And then we can talk about what the questions are. So there are 4 Massachusetts-based annual conferences. There's MIHA, there's MAPHN, there's MAHB, and there's MHOA. MHOA is one that all folks might attend. MAPHN would be something that nurses would be attending. MIHA would be generally for the environmental health folks. MAHB it's Mass Association of Health Boards training, but it is something that's actually useful for all staff. And I know last year I attended, Sam attended, and it's my intent that shared services staff would be attending, because I think the knowledge that Cheryl Sparra and her team impart is helpful for staff and not just health board members. So I did include costs. I really want to just kind of show you, as I said, what the breadth of the question is. So you can see the cost range from a MIHA workshop for a non-member of $25 all the way up to the MHOA conference. We do not do out-of-state conferences. We're not allowed to by grant. There is, I did include NEHA annual because last year we were allowed to send people virtually to that. So I just include that as a possibility. Sorry, NEHA being National Environmental Health Association. Okay, so that's the conferences. And then for memberships, we have, so there's one regional membership organization, that's the Association of Public Health Nurses. And that's $500 for our region. Then there's a community-based membership, Mass Association of Health Boards. That's the one that we just approved the fund. So that's 100 and sorry, that's incorrect. I said 150, but it's 125. It's 150 on the slide, but it's 125 per community, right? Then the 4 the membership organization, the 4 others are membership organizations. So there's Mass Environmental Health Association annual membership $50, MHOA annual membership $60. NEHA, which is required for our RSs, that membership's $100 annually, and then the Mass Association of Public Health Nurses, that's 105 for NEHA and 100 for MAPHN. So, so the fees vary a little bit, and who participates varies a little bit depending on licensure. And then now I'm going to stop sharing that, and I am going to share a beautiful Excel spreadsheet that I know you're all gonna be so excited about. Okay. So can we see that? Do I need to make it bigger? Do I need to adjust in any way? You can see the column with people's names on the left-hand side, and then, okay. So what I did was I did a staff breakdown. This is, so there's 5 groups of staff that would be staff and board members, as the case may be. And the first one is shared services. So that's, as you can see, I mean, that's everyone on our org chart. That's me, that's Sam, Amy, Jen Casey, and Jen Gangadaran. Who's at a housing training this morning, which is why she's not with us. And then I listed the possible staff and board members from each other community. So we've got 2 folks from Dover, to my knowledge right now. So these would be people who may be interested, maybe wanting to attend a conference, may have a membership fee. So there's 2 from Dover. From Medfield, there is 6, with the caveat that, so currently the health agent in Medfield is a contractor, and independent contractors are required to pay their own expenses. So they actually are not a likely party. I just included health agent, so that you knew it was in the realm, right? So then Needham actually is so I have our 2 board members. I have potential staff that may contribute to our meetings, and then Sherborne. So Sherborne is Daryl, Julie Dreyfus as the alternate, the health administrator position, and then the role of, there are 2 part-time inspectors and there's a public health nurse position, right? So there's a range of organizations, there's a range of costs, and there's a range of numbers of staff and types of staff. So what I did to fill this through was I went through, and the first section is memberships, and that what I did was just mark off where it was possible that someone might be attending a conference, or needing a membership or attending a conference. And you can see MHOA, typically well-attended, cross-cutting, broad appeal for that conference. The others, it varies more based on whether you're a nurse or an environmental health inspector. And then board members, not required for other things. Some board members might like to go to MHOA. I hope all board members would be able to figure out how to go to a MAHB session, right? So, I started this actually thinking I could make it like an algebra problem and make it sort of simple and just say A to B to C. And it actually, because each of the factors has some complexity to it, it's not quite that simple. The reason I bring this to you is what we've done, and I've checked with other shared services groups. Generally, shared services groups right now don't have a policy that says we'll pay for all MHOA memberships and we'll pay for everyone to go to MAHB. They just take requests and they pay them as they come in. And if they have enough money, then they pay them. And if they don't, they might try and adjust the budget that felt a little haphazard. And, I raised this with you all previous and folks agreed that they'd like to have some kind of policy discussion about this and come up with a rule. So, I think that, all right, I've got to stop sharing this one so I can share with you what the questions are in front of us. But I think, the question is, first question for me was, what are the communities paying? And you'll see I didn't have a lot of population for paying for memberships or conferences from Needham, because I happen to know, because I could easily access that info, that Needham pays out of their own municipal budget for folks to, attend conferences and the like. That's part of their budget. But what I'm not aware of is what the budgeting practices are for Dover, Sherborne, or Medfield. So while I'm switching my screen to share, can I ask you know, what other folks what other communities' practices are. And I'm gonna go alphabetical. Dover.
Jason, correct me if I'm wrong, but we pay for a few conferences. We don't, it depends on, I would say it depends on what we have available in our budget. We try to send people to conferences.
And what about membership dues? Thank you, Kay.
I don't know about membership dues. Jason,
We pay for those typically.
Okay. Thank you. Medfield.
Hi. When I started with the board, 9-10 years ago, we used to review the budget and sign off. We still request to review the budget. It's has in the past included membership fees for MHOA only that I
Mhm.
can report. Medfield's health budget is a half-time office manager, a consultant health agent, and a full-time public health nurse, and very minimal other funds.
Okay. Okay. Sherborne.
So we have been paying the dues for MAHB, MHOA, and maybe NEHA, but I'm not 100% certain on that one. And for MAHB conferences, that's always offered to all of the board members
Mhm.
at the present time. I'm often the only board member going, but you know, sometimes there's more, it depends on people's
Yeah.
schedule. And the board is paid for that. And the MHOA conferences, we've typically only sent the administrator and health agent to that.
Okay. And can I ask, when you say MHOA memberships, are you paying, are you paying the membership fee for the health administrator and members of the Board of Health, or, because that's one of the individual ones?
Then it's probably for the administrator.
Okay.
Because the board, you know, I've never even contemplated going to an MHOA conference because it is more time away from work and what have you. So, and I think that's the same for all of our other board members, really.
Mhm. Okay. So thank you, that's helpful. So really the crux of the question here is, what's the reasonable and appropriate number and type of conferences and memberships for each community that we ought to allocate funds from shared services to pay for? You know, it sounds like there is funding in each community's budget to pay for things. It varies some based on staff size and staff size and I'm not, interest maybe isn't right. And again, I think part of the reason this came up was, you know, we were fielding individual requests. You know, we had staff from Sherborne were reaching out directly to us, asking if we could pay for their membership and their attendance at the conference. And we directed them back to their town because that's not our decision, but it's trying to figure out how we how do we square this circle or circle the square and allocate fairly. I was going to suggest that we say, you know, we could pay for attendance at MHOA because that's a big ticket item, and ask if communities might be interested in keeping, you know, paying for the licenses themselves. Or, you know, do we pay for one membership and one conference attendance? And then if I get additional, we'll reach out, and if there are additional requests, we can see if we can accommodate it, make sure that all 4 communities have a chance to send folks. What are the interests of the body? I see head nods.
Mm.
I want to make sure that we maximize available funds to send folks to trainings and conferences that are of value. That's part of the purpose of the grant. But I also, don't, I want to make sure if we're just going to take all comers that folks are comfortable with that. We could certainly continue doing that.
I mean, Carrie, focusing on the MHOA conference seems to make the most sense. I mean, that's a big ticket item.
Mhm.
I mean, just to send one of us, I mean, I know Jen just did all the billing stuff. It's, somewhere in the range of $700 plus hotel expenses and all that other stuff. So I
Yeah.
think kind of making that the main focus and then, maybe worry about other stuff afterwards, whatever may be left over.
Okay,
Just my 2 cents.
thank you, Jason. Yeah, thank you, Jason. Does anybody have
so-
any other thoughts? Oh, sorry. Is that you, Daryl?
Yes, sorry, I wasn't raising my hand.
Oh, it's okay. Okay, Daryl, your camera's not on. I don't know if you knew that.
No.
Oh, okay. Okay.
The
No, that's
internet
good.
connection is not the best here, so it'd make my communications choppy, so.
No, understood. Yep.
Okay. I was thinking similarly because the MAHB I view as so basic for us to be participating in that. And I think it's also really important for us as a town to offer training to the board members who come and go. And that just seems like a basic obligation that I'm comfortable keeping in the town and reserving the funds for things that are more challenging. And part of the reason we haven't sent board members to MHOA conferences are because really we're relying on staff for those technical services and want to make sure that they have all the support that they need.
Okay. Makes sense. Any other thoughts, questions?
I just want to, well,
Sorry.
Yeah, I think-
I agree with Jason. I think the MHOA conference was incredible. I know Kathy went through shared services. I went through Needham. I was only there for a day, but it was great this year. And I think your question, if I'm correct, to fund a baseline, and we all agree on that, and then see during the year if requests come up.
Yep.
If that's what I agree with Jason, if that's what you said, Jason.
Okay. Okay. Ed, what, you had a comment?
I think the position that Daryl stated is a pretty good one. I think that the MHOA should be funded for staff members of health departments.
Mhm.
But I think that health board members, it's more appropriate to go to the Mass Association of Health Boards trainings and conferences.
Mhm. Okay. Thank you. This is helpful. I know this is a little dry of a topic, but trying to figure out the logistics and what we're trying to figure out how we're sharing and what are our priorities and what are we allocating. And I think understanding what each other's positions are is important and valuable. So, okay. So then I just want to, what I'm hearing is I'll budget to send as many people as possible to Mass Health Officers Association conference, and that would be staff members is the priority, is what I heard. And prioritizing Mass Association of Health Board trainings for board members. And we didn't talk at all about membership fees. Does the body want funds to be used to pay membership fees for individuals, or is that something that they would like to keep in the municipal budget? Ed?
Again, I think you want to keep some stuff in the municipal budget. Otherwise, those
Right.
budget lines, if we don't use them, they tend to disappear, and it's torture trying to get them back.
Yep. Point well taken. Any other thoughts? No, the head nods. Okay. All right, great. Thank you for that guidance. I appreciate it. So we'll focus on making sure that we get as many people as possible to the MHOA, and making sure that there are funds for Association of Health Boards attendance. Individual membership fees would be the responsibility of the municipality. Will continue, shared services will pay for that regional membership for the Association of Public Health Nurses. And revert the MAHB membership in next year to back to the towns. You want to keep that on your budget. And we will we'll implement that. So then I'd say this is really helpful for particularly for Jen and I, as we're trying to field the questions that we get of, well, can you pay for this? And would we, would we do this? And it means that we can make some better informed decisions and feel like we are following what your wishes are. So then I'll just say.
Oh, Kay just has her hand up.
Oh,
I don't know if
thank
you
you.
can see it.
Yeah,
No, thank you.
I just want to say that I certainly agree with this. I think that based on last year I went to the MHOA conference and I thought it was really extremely beneficial to me. And I'm not a staff person, but I think there are going to be times when someone from a board might want to go. And I as long as we don't preclude that option.
Okay. That's yeah, okay. So looking at budgeting to so prioritizing staff and also budgeting to include for board members, not limiting solely to staff. I think I'm glad to hear you thought it was a great experience last year, Kay, and I hope you can maybe next year we'll work for your schedule and because we'll talk a little bit more about the conference shortly, this year's conference, but it really was quite interesting and valuable. And I know Kathy McDonald, we were able to send her via the Shared Services Fund, which I think is an excellent thing. As the supervisor for the public health functions in that department, really helpful. And I'm not sure that would have necessarily fallen in her budget, right? So I think that being able to encourage folks to attend and make that available, I think it's important and useful. So, okay, so staff and board members, so all comers basically for MHOA. Board members definitely. Staff members for Mass Association of Health Boards. Any objection to payment for staff members to attend? No. Okay. Good. That one's on a Saturday, which I think is part of the challenge for folks to attend. I know for our staff, we give comp time, and if somebody attends on a Saturday, then they get a day off in exchange. But okay, so then I just want to talk briefly about logistics of this because what we need to do is not have individual staff members from communities asking. We'll send it back to your community, but I just want to make sure that you all hear me. So it would be, we want an advisory board member, to sort of be directing. And I might say, I'm going to plan to send all these people and y'all will nod off on it. But we just want to kind of limit the direct contact to our office asking for payment. And then I just want to clarify too, the means of payment. So Charles River can pay directly. Jen registered everyone for MHOA and she did the registration and then the hotel arrangements, and that's easy because then we're just paying it all directly. In some instances, it might be advantageous for the community to pay. And if they did, then so say Dover paid but wanted to be reimbursed for that. Dover would then need to invoice Charles River. The town of Dover would need to issue an invoice. We we couldn't pay the invoice directly, the MHOA invoice, if you received one. And we can't ever reimburse, do direct reimbursements to somebody who's a non-Needham employee. So if you're paying out of pocket as an individual, and you want shared services ultimately to pay for it, you would need to ask your town to reimburse you, and then ask your town to ask shared services to reimburse us. So it's a little complicated. Basically, either the town should pay, or you should ask Charles River to pay. And we really want to try and keep it out of individual payment generally. Makes sense? There will be no quiz. I just want to make sure, happy to say it over and over again, but I just want to give you the guidelines that we're kind of working within. So there are no surprises. And okay, all right. That is great. Thank you for working that through. Let me stop sharing this. And actually, I'm going to go back up to, so I want to do staff reports now, and I will start with, so here's the summary that Sam and Amy pulled together for us of the different instances of service in each community by shared services and inspectional staff for the month of October. And as you can see, I think, so there were 4 food inspections in Sherborne. There was a Title V shadowing. Sorry for the alignment. I didn't have the Excel, and I couldn't make the adjustments. Sorry. So there are 4 food inspections for Dover. There was a Title V shadowing for Sherborne. There's not been any service instances in Medfield, and there were 5 food inspections for Needham. So, any questions about that? No. Okay. So then we have kind of a array of updates for you all, and I'm gonna start off.
Carrie, can,
Yes, ma'am.
thank you. So thank you for sharing this. Can you remind me, now that our IMA has been signed, and how these requests are initiated? Because we are grateful for the participation, and also our contracted health agent, who's been with Medfield 15 years, announced at our last Board of Health meeting that they would be stepping down. And so our town is going to be in the process of coordinating replacement. So how do the requests come in, and what's reasonable to expect?
Yeah, so I'll start and handing to Sam. So I'll say we don't have a formal request process right now, and that's by design. We recognize that this has been a new thing, and there's a relationship building piece, and so there's not been a formal process. It's part of our deliverables to create a process. And our intent is to make it as easy as possible, to not have there be barriers. That said, we know that as everybody becomes more comfortable with using us, we're going to have some kind of again, policy, kind of like conferences of here's what we think is reasonable, here's what we think we can handle. Sam, off to you.
Hey, Carol. I would just say right now, any request you could send to me directly. I will say, just looking at Amy's schedule these past couple of months, she's pretty maxed out right now in terms of the past couple of months, Needham and Dover just happened to be very busy on their food inspections this time of year. Amy's going through a lot of training periods right now. So Amy and I have already discussed in the new year, we're going to reevaluate what her capacity is, and we might bring a discussion back to the group. We have not been in this instance before where we were really at capacity. So I think we might be making some decisions in the new year, especially if we keep getting more requests from towns, which we love. Just making sure it's divided like equitably amongst the towns. So more to come on that. But in the meantime, if you have anything, let us know so we can, have that in the consideration of where we're allocating our time.
Thank you.
I have to jump off, guys. I have to run to another meeting. But it was nice seeing everyone. Carol, I just wanted to share also, Dover obviously is always willing to help out. Just, if you guys have anything where you need to bridge a little bit of a gap or anything like that, just let me know.
Thank you, Jason.
Anything I can do to assist.
Thank you.
But thank you guys. Take care, everyone.
Thank you.
Thanks, Jason. Take good care and happy Thanksgiving. Oh, he's gone. He's fast. Okay. Right. Okay. So any other questions about just sort of the logistics on those service instances? Or can I move on? I don't see anybody asking questions. So I want to start off with so I have listed the MHOA conference. I actually want to go a little out of order and acknowledge that the SAFE 2.0 bill that has been moving through the legislature for a long time was incorporated into the Mass Leads Economic Development Bill. That bill was signed, was voted on affirmatively on Thursday. And then I believe that the governor signed that bill yesterday. And I'm looking to Tim because he is most knowledgeable about this. If he has anything to add about SAFE, that passage and implications for folks.
No, you said it right. Last Thursday by the legislature, Wednesday, yesterday by the governor. Long time coming. It does a lot of things to help modernize public health. I think the sort of next step, not that people who've been working on it really want to talk about next steps right away, but is to then go to the legislature and say, we've set these standards, we've set these professionalization marks for local public health, for the staff and for the departments in terms of how they have to perform, what are the minimum levels, and now we need some resources and some technical assistance to get there. So the work's not done, but it's a major step to move beyond the statutory requirements and to try to start addressing kind of the foundational elements of public health, what'll really sort of move the needle on some of the key drivers, the social determinants of health.
Yep. Thanks, Tim. I know I was able to share the news last night on my Board of Health meeting. I was super excited. It was I'm very proud to be a public health person always, and it was just awfully exciting to say, yes, this has been accepted by the legislature, signed into being by the governor. And so I know I've mentioned before foundational public health services, and that is something that's one of our deliverables for this year. And the Office of Local and Regional Health has just begun their process of bringing in shared services coordinators to talk about what those foundational public health services are and how we're going to talk about them with our shared services groups. So I think there is an upcoming meeting on December 4th that when we get the invitation from OLRH, everyone will be invited we'll be responsible for attending and making sure. Then we'll bring stuff back to this meeting, and there will be some homework and some more assessment, sorry, but but valuable, and yeah, it's a big step forward for us. So thank you, Tim, for, I know all the work that you've done. Thank you. So right, okay, so now I'm gonna dip into MHOA conference, and I am going to let Sam go first, I think. Sam, what do you want to share with folks about, the conference and anything else you want to update?
Sure. So I definitely attended some interesting sessions, but I was actually an undergraduate in animal science major. So One Health and zoonotic diseases are close to my heart. I went to a session by Katie Brown, who is the state epidemiologist and public health veterinarian. And she had some topics coming up on the horizon and things to really pay attention to, mostly concerning tick and mosquito-borne diseases. And I know with some of our communities being much woodsier, some things to think about. It was really interesting because she was actually making the case that more than even climate change, land use changes in Massachusetts are really what's probably driving the increase in tick and mosquito-borne illness in the state. Basically, a couple hundred years ago, the whole state was plowed over, forested a lot of it. So some tick and mosquito species that had previously existed were kind of, lost their habitat, driven out. Whereas now we're, changing back to having a lot of those forested areas, and it's actually bringing species back, and with it along some of the diseases they carry. One thing that's really interesting is the Lone Star tick being reestablished in the state and bringing with it something called alpha-gal syndrome, known as AGS. And it's basically something people will get that makes you allergic to a certain protein as it's sort of like defensively your body against the tick bite. They carry this protein that's also carried in a lot of other meat products and other things, has a wide range of symptoms. Really hard to predict and can really impact people's lives a lot by just giving them severe allergic reactions to just normal dietary things for, unknown amounts of time. So that's one thing to be on the lookout for. Obviously, triple E, Massachusetts by far has the most incidence of triple E in the country. We anticipate that's probably going to continue to rise, so something to be aware of. And then lastly, she touched quickly on H5N1 bird flu. I don't know who has been keeping up with that, but mainly that is crossing over into dairy cattle and some other cattle. The good thing with that, as incidents of that go up overall in the country and even Canada, is a lot of the cattle populations we're seeing that in is in the South and the West. And Katie Brown was saying that New England is luckily pretty insulated from that because we don't import cattle from those areas of the country. So certainly something to be on your radar in coming years, but maybe not as pressing an issue in Massachusetts as other regions. And the state is conducting routine surveillance now in the cattle populations in New England, well, at least in Massachusetts, to keep an eye on that. So those were my big takeaways. Things I think to think about locally is those, especially the tick seasons, as we have warmer winters and things, and the fact that a lot of diseases can be transmitted even when they're in the larval or nymph phase. We need to worry about tick-borne disease for most of the year, even in the colder months. So just being aware of that. And Katie Brown ended by just saying, unless basically you're on Comm Ave in Boston, ticks are something to worry about anywhere in Massachusetts. So things to think about.
I have a question for you, Sam.
Sure.
Did she happen to mention anything about whether H5N1 can be transmitted from cattle to milk, and whether there's any risk from drinking unpasteurized milk of
So she did mention that specifically, that it was very low risk in pasteurized milk, because that would kill the virus. So that's pretty low risk, and also did put in the caveat that like drinking raw milk is a high risk food item, for that, and we should be drinking pasteurized milk. So she did talk about that a little bit. Amy, I saw your hand up. I don't know if you wanted to add anything there.
I was going to say exactly that. And also she said it's really more of a risk for people that deal with cattle directly or interact like near their udders, because that's where the virus is being held, in their udders.
Great.
Thank you.
Thanks, Sam.
Does the raw milk issue extend to raw cheeses? Do you know?
So
Baking process also something that I'm just wondering if people ask, I wouldn't know what to say.
sure, and I think that would also probably depend on if the cheese was aged for a certain amount of time, and probably about the moisture activity in that cheese. So I'm really not sure about that, but I would say in general, drinking like or eating any raw cheeses or milk products, I think are a high risk for a lot of foodborne illness areas. So I would always advise people against that, but not specifically sure about the cheeses.
Okay.
Thanks, Sam. Any other questions for Sam? Carol.
I always have questions. I'm looking, excuse me, and thank you, Sam. There was a few things at the conference. One of them, I wonder in the future if you both can add them to the agenda. Things that, you know, like I don't have a full understanding of, but I think can benefit us, like this data solution program that OLRH, you know. And my question ties into the survey that Amy sent and what our obligations are. And I've been taking a lot of notes for Kathy and Steve. So our obligations are to this group as far as our work and our capabilities as a region, but also tying in some of the things that OLRH is doing. It just is a lot of silos for me. So it was a reflection on the conference, some information that I picked up, particularly on this data thing, because it has public access, I guess, in the future, and then it has staff access on inspections, and then how do we as boards members, or because that's the people right now that work in this group for Medfield, report accurately to the survey that Amy sent and the services, because we all want to be responsive. And then does that information go into this?
So the self-assessment that you are all completing, and Amy, it's Amy's turn next, and I know she was going to talk about self-assessment. So nice setting her up, Carol. But the self-assessment is just that. It's a self-assessment. We're entering the data internally for comparison to what's in the standard right now, what you'd see on the dashboard for the state, but it doesn't go beyond that. And what your responsibilities are exactly what's outlined in that assessment. And now your responsibilities are going to expand because there will be work on the foundational public health services. I absolutely can add to a future agenda some specific information about the data solution and the direct impact and implications for the individual communities. Happy to do that. And Amy, why don't you take it away?
Yeah, great. So self-assessment, yeah, that's not really related, Carol, to the data thing. That's like the state, and that's just like a separate thing. The self-assessment is just for us to use within the Charles River Public Health District to make sure that we're meeting the foundational public health services. Whereas that data, I can't remember the other word part of it, but that's just something that's separate that the state's working on. We don't have any say in that at this point. With the self-assessments, I have them due on Friday, which is tomorrow. I do have 2 that I received already. I'm waiting on 2 other towns, and I've been in contact with both of them about that. And if there's any issues meeting that Friday deadline, we can talk more about it independently, but so far so good. Everything looks like everyone's working on it. So the goal with that is once I receive them back, I'm gonna compare the responses from when it was filled out 2 years ago to what everyone put now. And the spreadsheet does have some comparison points for that, and I'm gonna just summarize it all together and identify what standards still need to be met and how we can meet those. And then me and Carrie will bring that back to you in a meeting probably in the next 2 weeks. I'll probably reach out to you next week to set up a time to do that. It would take like probably an hour to do. And then we can go from there, but the main goal is to just identify what we still have to work on. So that's what I will be identifying for us and then talking about from there. But yeah, I'm really excited to do that. And I'm looking forward to seeing everyone's responses and coming up with some good solutions for you. Sam.
Hey, I just wanted to throw in there, once we have those results as well, the plan is then for shared services to really help the towns tackle meeting any of the unmet standards. So some of that might be like looking at the workforce standards and training opportunities and education. Some of that might be, okay, where can shared services staff physically help like step in and complete inspections and other things. So this will be like really informative and really help us target where we can specifically help everyone to meet all the standards. So we're really excited to have those results.
And remember just that those standards are currently, that's the floor, right? That's the minimum. We are looking at the foundational public health services, which encompass a much broad, the broad scope of public health. So so excited to help y'all get approach that 100% for the floor and get well situated to be moving even higher. Carol, am I reading your face that there's a question? Yes.
Yeah. So we have some transition. So Steve will be following up on who's filling this out. I know 2 years ago it was our nurse. So we'll follow up to make sure Medfield has staff that is doing it, and we'll be in touch.
Okay.
I have heard from some staff, Carol.
Yes. Yeah.
Good. Then
We're hearing from
we'll
Medfield.
talk to you offline.
Great. Awesome. Any
Thank
other
you.
questions about the self-assessment? We'll talk more about it once we have some like results and more like main things to report back on what we can work on in shared services. But right now we're just kind of coming to the end of filling it out, which is great.
Right. So, and Amy, just to put a real specific point on it, we are, you heard from Christine Trierwiller that she is working on that. And you've heard as well from Nancy Benatti in the Medfield office, but Christine has committed to completion of it. So, okay. All right. You know what? I just noticed, unless I've lost Kay on my screen somewhere, we have lost quorum.
Hey, Kay is trying to get in. Power went out at her house. She's trying to phone in, and I'm just going to let her know about the correct password.
Thank you.
Wow, it is pouring outside where I am.
Is it?
Yes. Thank goodness.
Yes, I know. Turning to my Robert's rules experts, Tim. I mean, I'm pausing because we're not supposed to be conducting business absent quorum. Do you agree?
Yes. We could certainly talk about something that, well, shouldn't really talk about anything that's not on the agenda either, but
Okay.
yes, we can pause for a few minutes.
And I know Ed, you need to leave at 10:30, yes? Is that
No,
correct?
today I don't. I can leave later.
Oh, good. Okay, great. Is anyone else like me surprised that next week is Thanksgiving?
No, not really.
No?
I thought
It
it should
caught
be
me, but,
this week, actually.
oh, yeah, I can see that. Yeah, somehow it kind of snuck up on me. I'm not quite sure how. I'm glad I'm not the only person that had snuck up on, but.
For me, I think it's because we had such an extended, warm, like end of summer where I feel like fall only started 3 weeks ago. So this feels
Yep.
too early for me.
Agree. Yeah. That was kind of my thought. I was like, wait, I think it's same thing when the snow report came in. I was like, but wait, we haven't really had true fall yet. How is it's been, as you said, summerish. Although I'm not a big fall fan, sort of the rainy part of fall that goes into winter. So I'm not complaining.
We need this rain desperately.
We sure
so.
do. We sure do.
So this is not really a shared services issue, but just for those who don't know, so Sherborne is going back into a search for an administrator. Our
Mhm.
last
Has that
administrator
position been?
voluntarily resigned, so.
Mhm. Has that position been posted, Daryl?
No, we're going to be, we've had a lot of issues going on, and so we just want to re-examine what we posted before to be more clear about what the position entails. See if we can improve on that.
Mhm. Great. When it is, when it is ready for posting, let us know when we can, share with our networks as well.
Okay.
Daryl, we can
and-
also get it posted on the OLRH sends a weekly newsletter to anyone who signed up for it, which at this point is virtually like everyone in the local public health sphere, called The Pulse, and we can get it posted for free on their newsletter.
Ooh. That's great. And partly because that would be reaching the right audience, I think. Or more potential to reach.
Yeah, absolutely. That's probably the widest range of the local public health audience that you're going to reach.
Tim, can we talk about the awards at MHOA? Do you
Yeah.
think?
I don't see why not.
Yeah. There were a few awards. Notably Tiffany Benoit, the public health nurse and assistant director here in Needham, won an award. Tim, you want to tell us about it? Want to brag on your staff?
Sure. The Sirocco Award, which named after Michael Sirocco. I'm going to get myself confused now. I'm going to close that one up. But basically, it's for contributions to the professional association. And Tiffany was involved in the conference committee. She was the co-chair of the public health nursing and epidemiology tract, and she took a major role in working on the LFIT camp course in terms of revising the curricula and also being the video host for all of the segments. So Tiffany was selected for that one, which was great.
I heard she even got out in the pond to help on the camp video.
She did, yes.
She did? I
That's
hadn't heard that.
commitment.
That's awesome. Yeah. Daryl, have you, has Kay been able to, have
She
you been able to
hasn't-
connect with Kay?
No, she hasn't. I'm wondering, what I didn't give her, because I don't have it accessible right now, is the kind of one tap mobile link. If I send you her cell phone number, could you send that to her?
Sure.
Okay, so let me get her number.
Does she have access to her email? Because I just sent her the,
I don't know
resent
what she
the-
has on her phone since her power is out. you know,
yeah,
I don't know.
okay.
I know I don't keep town email on my phone because it's my personal phone, so. Okay.
Anyone have any exciting Thanksgiving plans? Anyone traveling?
Eating a lot. Does that count?
Family Thanksgiving on the Cape.
Ooh.
Nice.
Or also since my husband and I have been cleaning out my mother's house and fixing it up for the last 3 or so months. And in the last ditch push to get everything out, we did pretty well, like distributing and donating almost everything in the house. Re-landscaping, painting, all that kind of stuff. But the things that we couldn't deal with, we just shoved in a truck and are now all over our house. So that's my other big plan, is to take some time and just try to get some order back in our own home. But, so if that's exciting, I don't know.
I would say it is. That qualifies.
Yeah, I think it'll be painful and then exciting once it's over, but. So that's as good as my fantasies get these days is.
I just want to say that it is raining hard. I think I heard someone say that. I'm here in
Yes.
Medfield before I have to leave the office to go to a meeting. And wow, it's pouring.
Yeah, it's pouring here in Needham too.
Yay!
Oh,
Yeah, because I'm all the way down in North Attleboro and it must be raining at least on the whole East Coast. So nice.
Good. Yep. Heavy
Now-
rain expected for many, yep, on my thing. So that's just good news off the agenda.
okay. It is not yet pouring or even, I don't think, really raining up here north of Boston, so.
Wow. Hmm.
Not yet. Something to look forward to. Okay, I've asked Jen to send that info to Kay's cell phone. We'll give it another minute and see if she's able to join us. If she's not able to, we'll have to adjourn. Well, we'll just have to end the meeting because we've lost quorum. But we got the votes in. We got the vote in that I needed, so
Good.
that's good.
Oh.
And
This is
then
just
may I
information.
ask, the next meeting is the 19th of December, correct?
Jen, is it the 19th or the 21st?
The
It's on the
21st is a
19th.
Saturday.
It's the 19th. Yep, it's the 19th. Okay,
Just making sure.
thank you. And we're veering it, but that will be an in-person meeting in Needham or a hybrid meeting. If folks would like to come in person, we would love to see y'all. Okay, I'm just gonna give it 2 more minutes. And our scheduled adjourn time was 10:30.
I'm just waiting for her
and-
to
Oh.
reply, see, to find out what exactly she needs. I just texted her.
I just have to go do something. I'll be right back.
That's fine.
I have an odd question. And I don't want to go into any details at all, but so we've just had a challenging circumstances in town for 8 years. Are there any kind of groups at the state level who could weigh in? I mean, we work with town council and other agencies, departments within the town, but who could provide any additional guidance to us on how to deal with that kind of thing in the public health arena? I just didn't know if there's something to give
Yeah.
us different insights or whatever. You don't have to answer that now, but if there is anything, I'd love to know about it.
So, and was this in the context of staff transition or was it?
No,
Sorry.
no,
Okay.
project work.
So, my go-to is always Cheryl Savara from the Mass Association of Health Boards.
Okay,
There is a subject matter expert contract that the Office of Local and Regional Health has with MHOA,
okay,
which is generally in the context of shared service agreements. But I think, if there was a retired health director that, had a good perspective, you could certainly ask them.
okay,
Or OLRH itself, either Sam Wong or Rebecca Kane, so the director or the deputy director of the office, are both, I think, really helpful. That's sort of my go-to. I'd go to Cheryl, I would go to the state, or I'd go to another sort of well-established health department. So if I need things, I usually often go to Segal, Reese, and Brookline, sometimes to Newton. Linda Walsh, their longtime commissioner, retired recently, so they have a new commissioner, Shin Yi, who's very good as well.
okay. Thank you.
Yeah.
So I'm not sure if she's getting my text or not, but I've sent her the phone number to call in and the meeting ID number and the passcode. So maybe we give it one more minute.
Thanks, Jen.
Carol, just adding to what Tim said, if you're interested in connecting with either Shinyi or Segal, I'd be happy to put you in contact with them.
Okay.
Okay, when it's 10:35, I'm going to say so one more minute, and then I think we'll just, we'll end the meeting, absent a quorum, and I'll add add other things to our December agenda and, move from there. Okay, 10:35. Thank you all for your time. Thanks for your participation. And we will see you on screen or in person on December 19th in Needham.
Thank you very
Yes.
much.
Happy
you,
Thanksgiving,
everybody.
everyone.
Thank you.
Yes, happy Thanksgiving.
Yeah, happy
Happy
Thanksgiving,
Thanksgiving.